Welcome. This video is going to look at the rest of section 15.5 on viruses, specifically at AIDS, which is a viral pandemic. AIDS stands for Acquired Immune Deficiency Syndrome, and it was first diagnosed in 1981. It's known to be caused by HIV, human immunodeficiency virus. We now know that it's transmitted through body fluids such as blood, semen, or mucus containing HIV, and that it's most commonly transmitted sexually or parenteral, which is by injection. It's a failure of the immune system, so the body falls prey to any infectious disease, such as pneumonia and cancers. It should be two, not toy. And it's estimated that 33 million people worldwide are infected with HIV, with a large proportion of HIV positive people in African countries. Fortunately, in the last 35 years, we've made huge strides at being able to control HIV from becoming full-blown AIDS. So the outlook is much better now than it's ever been for somebody diagnosed as HIV positive. Unfortunately, when the disease was first diagnosed in 1981, it was largely ignored for a number of social and political reasons. It just really is not one of America's bright spots in doing the right thing. So, how does the AIDS virus infect the body? It primarily infects vital white blood cells called T cells, or more specifically CT4 plus T. And these cells normally help our immune system. So the very cells that should be helping you are the ones being attacked. It's also a retrovirus, which means it contains RNA, not DNA. And the virus releases its RNA into the host, and then the enzyme reverse transcriptase controls and transcribes the RNA to DNA. The viral DNA gets integrated into the cell and then gets reproduced with that cell. So it's not where viruses that take over and then leave. This virus takes over, and then it's like it hijacks the cell, and the cell now does its bidding. It continues to reproduce virus particles over and over in its normal reproduction. So viral particles get produced in large numbers within the host cell and then get released when the host dies. So there's three main reasons why HIV is proven so challenging to defeat, either to come up with a cure for it or a vaccine for it. One is because HIV destroys T helper cells, which are the very cells the immune system uses to defend the body against infections like viruses. Secondly, HIV mutates very rapidly even within a patient. There is more variation in HIV within one patient than there is in influenza worldwide for a whole year. This means each individual body has to constantly make a new response for each variation. If you think about the challenge that the health organizations have each year trying to guess the best flu shot to make, there's even more than that going on within any one patient. And then third, the virus often lies dormant in host cells, so the body has nothing to respond to until the flood of viral cells gets released into the body. So you could be HIV positive and not realize anything's going on until suddenly you're very ill from the infection. Currently, HIV is best treated and controlled through the use of drugs called antiretroviral drugs, or ARVs, and there's about 20 different types available. They don't cure a patient, but they suppress the HIV infection. So now HIV is often viewed as being a chronic disease, one you'll live with for the rest of your life, but that's much better than being a fatal disease, which it was for the first 20 years or so that we knew about AIDS. So how do the antiretroviral drugs work? Well, they can act on the different stages of the HIV life cycle. Like they could attack the binding and fusion of the virus to the receptor on the CD4 cell membrane. They can attack the reverse transcription of viral RNA to DNA in the host cell. They can go after the integration or prevent the integration of viral DNA into the host chromosome. Or they can prevent the new viral particles from budding and being released off the host cell surface. Inhibitors of the viral enzyme reverse transcriptase are the most widely used ARVs. Like AZT is probably the most recognized antiretroviral medication used for AIDS, and probably been around the longest. But really what works best is when a combination of ARVs is used. So often you talk about a cocktail that people have to take. So despite having some good treatment options, there's still some issues with trying to treat AIDS. First of all, it's expensive. It costs around $1,200 a year for a patient to take his medications, and it's a commitment for life. And $1,200 a year is probably manageable for a lot of people in the United States, but the people in the countries who need the drugs the most are least likely to get them because $1,200 is a huge amount of money. And then secondly, developing a vaccine is still looking a long ways off because the highly variable nature of the virus and then its constant mutation and changing within cells makes it very difficult to come up with an effective vaccine. And even if they do come up with some possibilities, there's a very slow response of the immune system to the presence of HIV. So vaccine still looks like a very difficult thing. Our best shot at this point is probably making these drugs more available and more reasonably priced to everybody who needs them.